Smile greetings. You are watching my channel, Learn Sujok for free. And I am Teja Lupal. Friends, this is the 5th course with 10 videos in which you progress to energy healing. In this course, you will actually enter the magical world of energy healing using meridians. In order to gain from this course, you must watch my videos in the order that they are given chronologically, and also watch each video till the end. If you like my videos, then subscribe to my channel and press the bell icon next to it.
Smile welcome. Always remember that when treating a patient, if he is smiling inside his mind, then his energy is flexible and will respond much better to treatment than a person who is not smiling and joyful. So always smile when treating someone or when getting treated yourself and get the most amazing results. Now let us understand the criteria on the basis of which the diagnosis for meridian treatment is done. There are 4 main criteria. The first is organ criteria. For example, if there is a lung disease, then we will treat the lung meridian, which is the lung organ, etc. So we will either tonify or sedate the lung meridian. For brain or heart disease, we will treat the respective organ, the brain or the heart, by tonifying or sedating it. So this is the first criteria, which is the organ criteria, treating the organ which is diseased. Second criteria is the pathway criteria. The pathway criteria is the regional diagnosis. Which area has the problem and which meridian passes through that area is what is seen. Let us understand this through the presentation of meridians that we had seen. Let us just understand it in detail. Now see the lung meridian. All right. In the lung meridian, you see that it passes from this area to the end of the thumb, right? So the pathway diagnosis is that in case if you have a problem in this area, this part of the shoulder is paining. So that means that your lung meridian is affected and you should sedate the lung meridian. Or if this part of your palm, the side of the thumb or the palm that is just below the side of the thumb is paining, then that is the pathway for the lung meridian. So the picture here clearly shows where the lung meridian is passing, and this is exactly which meridian has to be treated if there is any pain along this path. Same thing for brain meridian in case there is a pain in the center of the elbow on the yin side. All right. And for like tennis elbow or things like that, you can treat it. If there is a pain in the center of the palm or in the middle finger, if there is a pain in the middle finger, so that is a pathway for the brain meridian. So you will sedate the brain meridian. Similarly, this is like heart meridian. Now, for example, if you see the spleen meridian, in case there is some pain on the side of the, just below the liver, you can say the right side of the liver or on the thigh. So basically you have to just see these, the path of the meridian and identify exactly where your pain is. If you have a pain in the inside of your knee, all right, inside of your knee, facing the other knee, then the spleen meridian treatment would be the best because that is the path of the spleen meridian. Now, similarly, if there is a pain in, say, close to the arch of the foot, or if there is a pain just below, in the breast, just below your nipple in the breast, or on the diaphragm area below that, then you can select this liver meridian. Or if it is in the liver itself, then also you can select the liver meridian, not only based on the pathway but also on the organ criteria. If there is a pain in the sole of your feet, the bottom of your feet, if they are paining, then kidney meridian could be the best. If there is a pain in the heel of your foot, then also the kidney meridian would be the best meridian to treat. In case if you have some problem with your nose, like nostrils, or if you have a problem on the top of your shoulder, this clavicle, and then you can treat the LI, large intestine meridian. In case of a problem in the back of the shoulder, just here in the back, or in the ears, just close to the ears, on the side of the neck, then you can treat this spinal cord meridian, or if there is pain in the, the back of the arm or the back of the elbow, then also you can treat according to pathway on the spinal cord meridian. Then the stomach meridian can be treated for any kind of face issues, like any problem in the cheeks or in the eyes or in the jaw or on the side of the face or in the nipples, any problem in the side of the neck, close to your navel and going down to the front of the leg. So this pathway would be, the stomach meridian would be very good for these, treatments according to pathway. For gallbladder, like the pathway is, the side of everything. So any pain in the side of the thigh or the side of the shin, the side of the knee, the side of the foot, or for any of these, you could try treating the gallbladder meridian. So, and any pain in the back of the body, on the top of the head, or in the back close to the vertebral column, or the back of the leg, or back of the heel. So these kind of problems, they can be treated with the urinary bladder meridian. So this is how the pathway works, and for that you need to have these pictures so that you are able to exactly identify or at least know the pathways of each meridian. This was the second criteria on the basis of which you select the meridian that has to be treated. The third criteria is energy criteria. Now, like if a person has high fever, then this is related to energy. This I will be explaining to you in the next segment of this course itself, where I am going to tell you about energy healing. So let's cover this criteria that time. And the fourth criteria is the time-based criteria. For example, a disease comes at a particular time. A person gets up in the morning, as soon as he gets up, he has a headache, say, or his eyes start paining, and it is at a particular time that it is happening every day. You should note down the time and then find out the meridian that is related to that time, and if possible, apply this. That is, try and harmonize a meridian according to when the organ related to that meridian is active. That is in its organ clock time. So the organ clock time are also important, that some organs become active in a particular time, at a particular time. And at that time, if you treat an organ, the result of the treatment will be much better. For example, the lungs are most active between 3 to 5 a.m. So any kind of treatment that you want to do for the lungs, the best time to treat it would be 3 to 5 a.m. in the morning, right? And for any kind of treatment for LI, like for constipation or diarrhea or anything, the best time to treat the large intestine meridian is from 5 to 7 a.m. For stomach, it is 7 to 9 a.m. Spleen and pancreas, 9 to 11 a.m. Heart, 11 to 1 p.m. Small intestine, 3 to 5 p.m. 1 to 3 p.m. Urinary bladder meridian, 3 to 5 p.m. Kidney meridian, 5 p.m. to 7 p.m. Brain meridian, 7 p.m. to 9 p.m. Spine, triple warmer meridian, 9 p.m. to 11 p.m. Gallbladder meridian, 11 p.m. to 1 a.m. and liver meridian, 1 a.m. to 3 a.m. In fact, the organ clock time treatment is very effective in some cases. For example, for diabetes. Now, for diabetes, you have to treat the spleen and pancreas meridian, and the best time to treat it with a magnet or color therapy is 9 a.m. to 11 a.m. So if at that time you treat your meridian, then the treatment will be much more effective for diabetes, and it will give faster results. So this is the fourth criteria to select which meridian and what time to be treated, what time it is supposed to be treated. So let me just repeat the four criteria. First was the organ criteria, based on the organ that is diseased. Second is the pathway criteria, depending on where the meridian is passing, the corporal meridian in your body, where it is passing, you can actually select the meridian according to that. The third is the energy criteria, which I will be telling you later on. And the fourth is the time-based criteria, which is very true for some meridians, when you can actually do it at the time that is mentioned there. So sometimes, like when you know that, okay, this is the meridian that you have to treat every day. So if you just refer to the organ clock time chart, then you'll know that this is the best time for me to treat this meridian, and I'll get faster results in that time. So then it is up to you. If you want to do it at that time, that will be good for you. After diagnosing the criteria on the basis of which you will treat, then we have to see whether we have to do tonification or sedation. If symptoms are acute, now tonification or sedation has to be done according to, I told you, to harmonize it. So according to whether the energy flow is too much or too less. So that is one thing. The second thing is, if symptoms are acute, that means they come suddenly and are very short term, and the energy is showing very strong symptom or expression. That means you have, like, suddenly you get a headache, and the headache is really very expressive, and suddenly it has come and it is really troubling you. Then the first step to do is to sedate the related meridian. For any symptom that suddenly occurs and is short term, has just occurred, and is very expressive, expressive in the sense that you can see it, that, okay, this is happening. So for that, you should sedate that meridian. As this is, considered as excessive of energy, that is why it is expressing and suddenly coming, showing its effect. Contrary to that, opposite to that, if it is a chronic disease means something that has been going on for a very long time, is not very expressive, the symptoms are slow, the expression is weak, there is dull pain. For example, you might have a backache you might have had it for a very long time. It is a dull pain which is always there. That means that these are homotype of symptoms. So first, tonification has to be done. See if the tonification helps you, because if it is a chronic problem and less expressive and dull pain and showing, very slow, and they have been there for a long time. So if you do tonification, and you will see that there will be some improvement in the problem. But if there is no improvement, then you can obviously do the other treatment. But most probably the effective treatment would be the tonification for chronic diseases. Then any organ that is suffering due to pain for a very long time, then that means there is no power in that organ and it is lacking energy. Pain came initially because of heteropower, which brought sudden change, and it was very fast, and suddenly the pain came. But then due to the homo force, there is no power in the organ, and the pain is like, it has been there for a very long time. And this happens because there is contraction, and there is no power in the organ. So this is how you have to understand whether to do sedation or tonification. So these are just general tips which you will understand on application, and everything you will come to know from experience. 12 organs have their meridians, but some organs do not have meridians. You must have noticed, like for example, the uterus. Now uterus does not have a meridian. Then there is one rule for these kind of organs. All hollow organs come under the spinal cord meridian. Okay, all hollow organs, and all solid organs like ovaries, breasts, they come under the brain meridian. So this is just a general tip for organs which are not covered in the access law and in the meridians, and this can also be applied. Or you can just go through the pathway and decide on the meridian. That is for you to choose. Now, another thing that has to be seen is rules for choosing the hand for treatment. This is very important as far as meridian treatment is concerned. So let me just go through this once. The first rule is, in case of organs that have 2 meridians each, okay, and that organ is receiving energy from both the meridians, right? The left heteromeridian and the right homomeridian. Now, this you know already, that every meridian has a left meridian and a right meridian, because you have a left brain meridian and a right brain meridian, and a left lung meridian and a right lung meridian, like that. Okay. The left heteromeridian and the right is the homomeridian. Now, if we are treating a female for stomach problems, then we will treat on her right hand. Okay, as a female is homo, and the right homomeridian will serve her well, even though the stomach is on the left side. All right. Now, to remember this, you have to always remember that a female is always right. Right. So that is why whenever you are treating a female for any disease, try and treat more on the right hand. But to treat a male for right-sided migraine, we will treat on the right hand as the problem is on the right side. Now, otherwise, for stomach and all, for other things, for organ related, you will treat on the left hand of the male. But if the migraine is on the right side, whether it is female or male, then the treatment has to be done on the right hand. In case of body parts, for example, if a person has left arm pain, frozen shoulder, and the pain is coming on the small intestine meridian, because that goes through, the back of the shoulder and treats the frozen shoulder very well. It is the small intestine meridian pathway. Then we will treat on the left hand small intestine meridian, because the pain is in the left arm. If a person has problem in the central area, like the nose or chest, then treat on left hand for male and right hand for female, because females are always right. Right? Then, in case of a problem in a big area, for example, if the problem is on the skin, which is covering the whole body, or muscles, or back, etc., then again treat on left hand for male and right hand for female. And in case of problem in symmetrical organs means like both eyes, both lungs, both breasts, something like that, then treat on left hand for male and right hand for female. Again, the same thing. So basically you are always treating on the left hand. The priority is that you treat on the left hand for male and right hand for female. But when the problem is a certain, related to a particular side, for example, if you have a pain in the left eye or in the left arm or in the right hand or something like that, then you have to take the hand on which side the pain is. So these are some of the rules that you can follow, and you can always digress, or you can try on the other hand. The treatment would still be effective, although it would be more effective if you follow these rules. In chronic cases, don't continue the magnet or meridian treatment for many days continuously. This is when you start the magnet or meridian treatment, do it for a week or 10 days, first 7 to 10 sittings, that's it. And then give a pause and then do again. So a pause of maybe say 2 days or, 2 or 3 days, and then start again if the problem is still there, because they are chronic cases. So don't just continue once you've started the magnet meridian treatment that you just keep doing every day. Do it for 7 to 10 days and then give it a pause and then do it, continue again after maybe 3-4 days. Also, especially in chronic cases, don't do metaphysical treatment every day. Metaphysical means this meridian treatment, as homoforce takes time to show its power or result. And so, sometimes it is better, instead of doing the metaphysical meridian or energy treatment every day, it is better to give a gap of a day or two in between 2 sessions. If the problem is chronic. For acute, you will obviously do every day or sometimes even twice a day. But for chronic cases, it would be nice if you do one sitting, one day treatment, and then give a gap of 2 to 3 days, then do the second session. Do 7 or 10 sessions like this, then give a good gap of say a week or 3-4 days, 5 days, and then start again if the problem is still there. So that way the energies get time to actually work. If you do every day as a routine, then we are unnecessarily disturbing the energies. And sometimes, simple treatments give the best result. So don't do metaphysical tonification and sedation every day as in chronic diseases, as this creates, traffic. And then energies wait for you to stop giving commands, and this treatment will not work. So for acute cases, you can do daily or even twice a day. But for chronic cases, I would suggest do one sitting, wait for 2 days, then do the second sitting, do this for 7 to 10 sittings, then give a gap of maybe 4 or 5 days or a week, and then start again if the problem is still there. When treating acute symptoms of pain, then your treatment will show instant result through with the magnet. But how do you come to know if your treatment for a chronic disease is working or not? So the way to judge this is if next day or in the next session or after a couple of sessions, you feel or the patient comes and tells you that you slept well, or you are feeling lighter, or that you're feeling more energetic, or your appetite has become better, then that is a signal that the energies are talking to you and your treatment is correct. So these are some of the ways that you can come to know that your treatment is working in chronic diseases. For all chronic problems, treat on long biole if possible, as energy is coming and going out. In our body, on yin side, energy comes from down, leg, and then supplies energy to the related organ. And then all extra energy goes to the arm and then goes out. And on the yang side, energy comes from the arm and then it stores energy in the trunk area and then goes out of the body through your legs. This is a rhythm, okay? This is always happening. So if a person has chronic insomnia, then long biole meridian is like, cause and effect. Then brain meridian has become weak, but the root cause is the liver meridian. In cases of insomnia, the brain meridian is weak. That is why you're not able to sleep. But the root cause of insomnia is the liver meridian. The liver is not functioning well. That is why the brain is weak. So you have to treat for insomnia the long biole of brain and liver. See, they are both the central meridians on the yin side. So they are connected through long biole. So you have to then treat both these. The liver and the brain meridian. Now, due to too much processed food, the liver of children these days becomes weak. And over a long period of time, gradually the brain also becomes weak because the liver becomes weak. So this is the reason the kids of today don't have the same kind of memory or intelligence that our older generations had. Always remember, in long biole treatment, that the status of both the meridians should be the same. That means if liver is weak, brain should also be weak. Then only you can treat, because then both of them have to be tonified. Okay? So they should only be treated when both of them are of the same status, both weak, both need to be sedated or tonified. So long biole treatment is done when two meridians are either excessive or deficient, and they are both tonified or sedated. So in chronic diseases, always try to ask questions related to long biole. Like if a patient has weak kidneys, he's come with a kidney problem and is getting dialysis, then always ask him about his heart condition, because the kidney meridian forms the long biole with the heart meridian. So if there is a kidney problem, find out if there is any problem with the brain also. Because if there is, then you can treat the long biole, which will be much more effective. And remember, the long biole can be treated on the fingers also, but it is more effective on the thumb. So these are a few tips. Now, in case of a person who has chronic high blood pressure for a number of years, then that means that the heart is getting weaker over the years, and heart is getting energy. Heart is getting energy from the kidney, isn't it? So that means that from the kidney meridian, and kidney meridian is the source, right? So in chronic cases of high blood pressure, tonify the heart meridian and also the kidney meridian. That's so you have to tonify the heart and kidney long biole. And the heart and kidney long biole on the thumb also can be tonified, which would be even more effective. Because both these meridians are showing deficiency, because of which the high blood pressure is continuing. Then in all kinds of trauma, like accidents, rigidity, body becoming hard, all kinds of attacks like epileptic attacks, etc., the body becoming cold, you should sedate the UB meridian. UB meridian is very important for these kind of things, for sudden accidents, trauma, rigidity, all these things. Then if a person has knee pain and sciatica, then two areas are involved, right? The knee is also paining and he has sciatica also, but they are two separate things. The sciatica, the knee pain is not because of sciatica, it is independent of that. Then two areas are involved. So to decide which meridian to take, there are two ways. First, ask which area got the pain first. Did the knee pain come first or the sciatica came first? Accordingly, treat the meridian, as one energy can disturb neighboring energies. So it is possible that if the knee pain came first and it was not treated, that is why the sciatica started. Or if there was a sciatica pain because some nerve was getting compressed in the vertebrae, then maybe because of that, the knee pain started. So find out which one came first and treat that meridian. That would be, if one meridian is treated properly, then it is influencing the other meridian too, and the other problem will automatically start resolving. So this is all that I have to give in this video. Watch this video 2-3 times so that all the rules of application and meridian treatment totally sink into your mind and you can absorb them thoroughly and try them out. Try them out for small things on your hand. They are very simple. Just keep all these colors with you, permanent markers. And whenever you have an issue, just apply the color or apply the bar magnet and you will see a difference and you will master this very soon. In the next video, I will share with you one very amazing feature of our hands, how our own fingers can be used as magnets. It is very interesting and handy in case magnets are not easily available. Or if you're not sure whether to tonify or sedate a meridian, sometimes there is a confusion regarding this. So then fingers can be used as magnets. Let me share that with you in the next video.